Welcome to the Creating Health Show. I'm Dr. David Haase.
Today I'd like to talk to you about complexity versus simplicity. Now, when we ask a question of someone, we really prefer to have a simple, straightforward answer and something super easy and actionable to do. What is 2 plus 2? Well, that's 4. And it's so easy. It's simple. And but when we ask about why am I ill? That is not an answer that resides in the realm of simplicity, unless that the person who's answering happens to be marketing something. So when really health is amazingly complex, because our bodies are complex. And it's important to recognize this, that in this quest to create health, our job is to, my job as a medical professional and a guide for the creation of health, is to help find what are the most likely hubs, what are the most likely tipping points that enable that system as a whole to find its way back to health. Now, I am also challenged when people say, well, what do you mean by complexity? What do you mean by a system? And I'd like to introduce you to a friend of mine. And this is my tensegrity structure. A tensegrity structure is a model of what is a model of a complex system, because there are a bunch of parts that have come together to be greater than the sum of those parts. We have dowel rods and rubber bands, and they have come together to form a structure that is far greater than them, the pieces individually. They have actually created a system. And when we think of our biology, our genetics, our metabolism, the influences of the environment, our beliefs, all of that comes together in the system that is our expression of health at that moment. And as we start to inquire about how do we prioritize, how do we address this problem of bringing a complex system like this into a state of health, we have to be willing to engage complexity. We have to be willing to be okay with probabilities rather than certainties. We have this opportunity to embrace reality, to engage in what is actually real, and but that's messy, and I think that that's an important reality to just state. Everybody wants a simple answer, but depending upon what field you happen to be in, you're going to recognize that there's complexity in almost any human endeavor. Depending upon if you happen to be a seamstress, and you know there's a tremendous amount of complexity about how cloth lay and various stitching and how different pieces fit together. And there are things that you've only learned as a result of working with materials, and things you can't even transmit in knowledge to another person. If you're a cook, how can you describe how to make your very best dish to another person? Certainly you can write a recipe out, but the quality of the ingredients, how they are transformed, how they're touched, in what order are they added together, and in what situation are they, what foods should they be paired with, and how exactly the spices should be arranged. All of that has a remarkable complexity to make the end whole. And if we think, stitching a piece of clothing is complex, or making a great meal has a complexity level to it, just think of the complexity that is present in the human system, the complexity of our desires, the complexity of our actual biology, of the wiring of our brain, of the number of relationships that we have as humans, and the number of potential interventions that could take place. It's quite dizzying. So our field of systems medicine is dedicated towards better understanding what is most likely to help an individual at a particular time. How do we better understand a system so that we can better focus the therapies that are necessary to bring that system back to a place of health and resiliency. It's a philosophical idea, but it has a lot of very practical ramifications. This is why a medical history is so important. Why, when people come to our clinic, they have to fill out a huge history form where we ask them all kinds of questions about their history and their lifestyle and their diet and their family history. And we put all of that together because that's going to start focusing us to understand the shape of that system, that particular human's complexity, in a way that gives us an opportunity to find where the tipping points are that are distorting that complex system into a state of disease or towards a progression of unwellness. I love complexity. It gives us an opportunity to really engage and be honest about the natural world. And that's why I think systems medicine is the medicine of the future, because it best represents and describes this complex biologic and lived reality that we as humans are experiencing. And especially it does that in a way that helps us understand what could be most helpful for a person to regain a state of health and well-being. So here's to a very robust and enjoyable journey down the complexity pathway. This is Dr. David Haase. Be Maxwell.